Hello there, Dr. Zakir with you. So, allergic rhinitis during pregnancy. For a normal person, when he is exposed to a dusty environment, he may be sneezing 1 or 2 times. A person diagnosed as allergic rhinitis, he is in the same circumstance, like he is in a dusty environment, he will sneeze about 20 to 30 times. So, what happens in such a person is that everybody has got a protective mechanism in the body, the immune system. If there is any dust, any bacteria, any virus, anything which tries to enter in that normal person, it tries to reject. In a patient or in a person with allergic rhinitis, what happens is that the immune system is hyperactive. It overreacts to the stimulus. That's what happens. Now, normally during pregnancy, there will be so many changes in the body because of the hormonal change, especially the progesterone levels. So what happens is that as and when the pregnancy progresses, as and when the trimester goes on, the patient or the pregnant lady, she will be experiencing nasal block. If the same person, she has got allergic rhinitis also, she will be suffering more. So what happens is, she has got sneezing, especially in exposure to dust or any other allergen she is known to, and she will have nasal block also, itching of the nose, itching of the eyelids, itching of the ears, and so many coming. So these are allergic rhinitis, and we are going in this topic, we are going to see how they are going to present, what are the investigation necessary, if it is necessary or not, and how are you going to treat with the least side effects. Okay, come, let us start. So, like how I have mentioned, allergic rhinitis is a multifocal IgE mediated hypersensitivity reaction which results in the common symptoms, complaints. Now, this one can be classified as mild or moderate to severe. In the case of mild, the patient is able to do the normal day-to-day activities and they can have a normal sleep too. The complaints that it doesn't hamper their activities and they don't require treatment. If it is moderate to severe condition, then it hampers daily activities, it disturbs their sleep, and it is very troublesome, so then they need to take medication. Now, the allergen can be any, like pollen, dust, or they have pet animals at home, it can be food allergy and all. Now, the complaints, like I have told, it will be nasal block, sneezing, and redness of the eyes, itching of the eyes, and itching of the ears and the throat also, some dry cough, and some of them, if it is severe, moderate to severe, they develop wheezing problem, breathing difficulty also. So we would like to do nasal endoscopy in such patient to confirm that it is allergic rhinitis uncomplicated, like it doesn't have any other complications, like rhinosinusitis and pharyngitis, all these become chronic, or eustachian tube dysfunction or ear related problems. So when you do a nasal endoscopy, what we will find is, if they have come during the allergic stage, so their nasal mucosa inside will be bluish, slight bluish tinge, and it will be edematous, and the inferior turbinates will be enlarged, and it will be irregular in shape. So when you do some investigations like differential count, the eosinophilic count will be elevated, absolute eosinophilic count values will be raised, C-reactive protein will be normal, it will be raised only during infection, and we don't do any sort of skin test during pregnancy. Total, it's contraindicated, and the total IgE level will be high. It's better that you do serum vitamin D assay also. Now, coming to the treatment. So, investigation is very less. So, coming to the treatment, so we'll see in 2 different parts, like the first we'll deal with the prevention, and second part we'll see how are you going to control the complaints, symptoms. Now, at home, prevention, what are you supposed to do? To start with, suppose you have any pet animals at home, you try to avoid the pet animals completely. If not possible, then try to keep it outside the house and keep a separate caretaker for the person, and the caretaker, if they want to come inside the house, they have to wash properly, then come inside the house. And the house, you try to keep it as clean as possible and try to avoid any stuffed toys being in the floor or the walls, Any toys are there, put it in the drawer properly, and all the curtains has to be plastic if possible, and avoid cloth or velvet curtains. And same goes for the furnitures also. It's better that you have leather furnitures, and try to avoid one covered with cloth. And when you have this plastic curtains, it's very easy to clean the curtains. The simple way is once every fortnight, just dip in lukewarm water, that is about 50 to 60 degree centigrade. Just dip in lukewarm water and put it for drying. Within, if the climate is little warm, it dries within 10 or 15 minutes. So it's very easy to clean also. So if the flooring happens to be, you have put a carpet on the floor, take it off, let it be tiles or cement flooring or wooden floors also. The mattress and the pillows need to be covered with plastic cover, and that has to be cleaned with damp cloth, that is dip in warm water, that is 50 to 60 degrees again. So cleaning is easy because you have a plastic cover, and daily vacuuming of the room is a must, and keep all the walls free of any stuffed toys like how I mentioned before. And when you have an air conditioner at home, try to clean the air condition filter as often as possible, so that it is dust free. And when you go out, there are a few more things to mention. The mattress which you have at home, the pillow, try to put it in in sunlight for at least 3 hours. That is from 11 a.m. to 2 p.m. There should be a little warm in that. And try to use minimal utensils and furnitures at home, so that you can do less work. You don't have to overburden yourself. Whatever I have displayed, I already have mentioned about it. And outside the house, you have to do mild exercises as far as possible because you're already in a pregnancy stage. You cannot do much. So whatever is possible for you at that stage, you have to do. And if you happen to go in the car, try to this car upholstery, let it be covered with leather, not with cloth. And don't hang any fancy stuffed toys near the mirror. Try to avoid all that. Now coming to treatment. The main treatment of allergic rhinitis during pregnancy is going to be nasal wash and antihistamine only when required, that too old generation. Totally try to avoid topical steroid spray. See, here I have written adult and child, this much of spray. That is a slide which has been taken from the normal this one. So the allergic rhinitis during pregnancy, topical steroid sprays, first trimester and the second trimester, there's the first initial 6 months, it has to be totally avoided. And the last trimester, if it is necessary, you have to get a clearance from the gynecologist, and necessary use a minimal dose possible. As my first option will be, try to avoid it as much as possible. The main treatment is going to be alkaline nasal wash and antihistamine, and the antihistamine is going to be old generation, not the new one, and that too just half the tablet whenever necessary. Leukotriene inverse antagonist, please avoid. Immunotherapy, that is a prevention, totally avoid, and no sort of surgery to be done. So to summarize, you have to do as often as possible, minimum of 3 times daily nasal wash and saline wash. Suppose you want to know the way of doing a nasal wash, please log in to or enter in YouTube Dr. Zakir Hussain ENT nasal wash. You know the technique of using it, how to use it and how not to use it. Those who find it difficult to use nasal wash, you can replace with saline salt-free nasal spray. That is a little more easier to use. As already mentioned, tablet old generation antihistamines, that too when necessary, if necessary, that too half the dose will do the job. Steroid nasal spray only during the last trimester, that too in severe allergy. If you are not able to cope up with your symptoms and it's very severe only, you have to take that to minimal dosage. So that is how you treat allergic rhinitis during pregnancy. And no surgical procedure usually is done. If at all needed, in the second trimester as an OPD procedure, simple procedure, some inferior turbinate procedures can be tried, but it's not of much help, because as far as the progesterone level is high and you have this allergic symptoms also, so it's severe, it's very difficult to control unless the pregnancy stage is over. So the best thing for you will be nasal wash and old generation antihistamines. Thank you so much.